Hi, Qualicare team. When you work with families living with dementia long enough, you start to notice a pattern. A family I met not long ago, I'll call them the Patrick family, illustrates it perfectly. Their mom had dementia. She'd been diagnosed for a few years, and like many families, they were doing their best to keep things going at home. But slowly things started to unravel. Mom stopped taking her medications correctly. She was waking up in the middle of the night, confused. Her daughter, who worked full time, was checking on her constantly. And every time something went wrong, a fall, wandering, medication confusion, they ended up in the emergency room. Everyone involved was trying to help: the doctor, the hospital team, the family, but no one was really coordinating the care. What that family needed wasn't just another appointment. They needed a system, a physician helping manage the medical side, someone educating the daughter about what to expect as dementia progressed, and someone in the home consistently helping stabilize daily routines and giving the daughter a break. That kind of coordinated support is exactly what newer dementia care models are trying to create. One of the biggest of those models right now is something called the CMS Guide model. GUIDE stands for Guiding an Improved Dementia Experience, and it's a national program created by Medicare to improve care for people living with dementia and the family members caring for them. The model focuses on three main things: dementia care coordination, education and support for family caregivers, and helping people remain safely at home longer. The program launched nationally in 2024 and is expected to run for 8 years. Now, before we go further, there are two important things to understand about GUIDE. First, GUIDE is not home care. And second, GUIDE is not private pay services covered by Medicare. GUIDE is a care coordination model run through clinical organizations like physician groups, memory clinics, and academic medical centers. These organizations build interdisciplinary dementia care teams that support both the patient and the caregiver throughout the disease. Most Qualicare offices provide non-medical private pay home care, which means we generally do not participate as a GUIDE billing provider. But that does not mean GUIDE isn't relative to us. In fact, it creates an opportunity. Because while the clinical team coordinates the care plan, families still need something very real once they go home. They need consistent caregivers. They need respite. They need someone helping stabilize routines and support safety in the home. That's where home care partners like Qualicare fit. In many coordinated dementia care programs, the clinical organization may partner with community providers who can support patients in the home. Those partnerships often include services like in-home respite care, dementia-trained caregivers, caregiver relief and support, communication with the care team, and helping maintain routines and safety. In those situations, Medicare pays the clinical GUIDE participant, such as the physician group or health system, and the home care agency may be paid through a separate partnership or contract, not through Medicare directly. So, our role is not to position ourselves as a GUIDE provider. Our role is to position ourselves as a trusted partner in the dementia care ecosystem. There are also some important compliance guardrails to keep in mind. Franchisees should not claim to be a GUIDE provider unless officially contracted. Claim Medicare covers private pay home care services, use CMS logos, or imply federal endorsement. However, franchisees may absolutely say, "We collaborate with dementia care programs and clinical teams. We provide in-home respite and caregiver support. We help stabilize care plans once families return home. We support coordinated dementia care initiatives in our communities." The key is to position Qualicare as part of the larger care team, not the billing entity. So, what does this look like operationally? There are 3 simple steps. First, assess relevance in your market. GUIDE may make sense to explore if you serve a meaningful number of dementia clients and want deeper clinical partnerships. Second, identify GUIDE participants in your state. CMS publishes a list of approved organizations participating in the program. These are often physician groups, memory clinics, primary care networks, or health systems. Understanding who's participating locally can help identify potential partnership opportunities. Third, assign internal ownership. Designate one person in your office to track these relationships and explore potential collaborations. Think of Guide less as a billing opportunity and more as a strategic partnership opportunity. In many cases, the role Qualicare plays is exactly what families need most: reliable in-home support that allows the broader care plan to actually work. And that's something we already do very well. Going back to the Patrick family I mentioned earlier, once the clinical team helped establish a clear dementia care plan, the piece that made the biggest difference was the support happening at home. Consistent caregivers, relief for the daughter, daily routines that help stabilize things. That's where home care partners like Qualicare often fit within coordinated dementia care programs. We become one piece of the puzzle, a vital part of the larger team supporting a family. Over time, coordinated dementia care programs like Guide are likely to shape how dementia care is delivered nationally. Understanding where we fit allows us to stay ahead of that shift while continuing to do what we do best: support families in the home. If you have questions about how Guide may apply in your local market, we'll continue sharing guidance and resources through Q Central and Q Connect sessions. Thanks, everyone.